In this video, we're going to be talking to you about what's called red flag symptoms for possible cancer diagnosis. And I've got my friend and colleague Lisa with me today. Thanks for joining, Lisa.
No problem.
And you're a GP nearby, aren't you?
Yeah, I work in Leeds.
Yeah. So hopefully you'll find this really helpful just to know about what symptoms there are to worry about for possible cancer diagnosis, when you don't need to worry, or when it would be worth giving your GP surgery a call. So Lisa, what is a red flag symptom?
So red flag symptoms are those that make us worry that there might be something more serious going on. So there's very common ones linked to different cancers. So today it might be worth talking through maybe the 4 top cancers in the UK and what those red flags for each one of those are.
Yeah, so that's breast mostly in women, isn't it? Yeah. Prostate in men, and then in both men and women it's bowel cancer and lung cancer.
Yeah.
Yeah, okay, great. And what happens if anyone does have these red flag symptoms? What does it mean for us? So
when you see your GP and you mention any of these and they cause alarm bells with us and we go, right, we need to investigate this a little bit further and make sure there's not a cancer here. So we have options. We can do some investigations or we can refer you on the 2-week wait pathway. Yeah, and you get seen very quickly then, hopefully just to have it ruled out, isn't it? Because most people don't have a cancer even when we put them on that pathway, don't they? Yeah, of course. It doesn't mean you definitely have cancer, but it's a quick way of finding out. Yeah, great. All right, well, shall we start talking about lung cancer? Yeah, definitely. Let's go. Okay, so what red flags do we see patients have with lung cancer? So some of the main ones, well, one major one is hemoptysis, which means coughing up blood. Yeah, that's definitely a worry, isn't it? Although sometimes people can be coughing up blood if they've just had a bit of a really hacking cough, can't they? Yeah. But generally, we always want to check out that it's not something serious. Yeah, it can happen with infections, or if you've torn a little bit in your throat, you can cough up a little bit of blood. But come and see us if you have this. Yeah, we still want to know, don't we? Yeah, and then they often have increased shortness of breath, don't they? Yeah, so the breathlessness, that's out of ordinary for them. Yeah. So after an infection has gone, you can be a bit more breathless. So if you're well and feel better, but actually you still have that breathlessness, come and see us. Yeah, because it's interesting you say feel well, because actually one of the other worrying signs is that kind of fatigue or very tired, isn't it? That somebody can't shake off, they just feel really tired all the time, and that in itself is a worry. Yeah, fatigue is one of those things. It's hard to gauge. Yeah. Have I just not slept well enough? Am I not eating well? But if you're doing all the right things and you still have this, lack of energy and tiredness, come and see us. It might be something going on. Yeah, and sometimes people are losing weight unintentionally, aren't they? So they're not meaning to. Yeah. They're not trying to diet, but they're finding their clothes are looser and they're losing weight. Again, we definitely have that as a red flag, don't we? Weight loss and appetite loss. Yeah. The two together or even separately. If you just feel not hungry anymore, friends are saying I don't look well or I've lost weight, definitely something to come and see us about. Yeah, and chest pain, that's another one, isn't it? So if you're getting chest pain, obviously we worry about chest pain for all sorts of reasons, but sometimes it can be linked to potential red flag for lung cancer, can't it? Yeah, so we've got kind of 7 main red flags for lung cancer. We've mentioned most of them, I think. Yeah, so it was and a cough that just, I think a persistent cough as well, isn't it? So if you've got a cough and you've been maybe treated for a chest infection and it hasn't gone away, so it's kind of we haven't got another explanation as to why you've got a cough. And that doesn't necessarily mean it's cancer. There's all sorts of other reasons why people can have a cough that doesn't get better, but it is something we want to get checked out, isn't it? Yeah, a combination of these symptoms or even them on their own and we can't explain them, we need to look into it. Yeah. So that's chest pain, appetite loss, weight loss, shortness of breath, fatigue, and the coughing up blood. Yeah. Well, the elephant in the room is smoking, isn't it? Especially with lung cancer, but actually lots of other cancers, because it puts you at so much of a greater increased risk of lung cancer, doesn't it? Yeah, so you're 26 times more likely to get lung cancer if you're a smoker. But if you stop, it still improves that risk a little bit. Yeah. So it's beneficial to stop no matter how long you've smoked. Yeah, because you often have patients, don't we, who say things like, oh, there's no point now, I've smoked for 40 years or something. And I would say, no, there's still a good time to stop. There's always a good time to stop, which is as soon as you can, really, isn't it? So if someone has got any of these symptoms that could be kind of these red flag lung cancer symptoms, what will happen next? So they come and see us in clinic, we examine them, and if we don't think there's any infection, we might do a chest x-ray and some blood tests. Yeah, and we probably want to get that done pretty quickly, won't we? Definitely, yeah. Quick chest x-ray, blood results, and then decide where to go next. And maybe they'll be sent on this 2-week referral pathway. Okay, so now what about bowel cancer? What are the red flag symptoms that we often come across with people who might have bowel cancer? So there's a few that kind of mingle into other cancers, but with the bowel, we need to worry about weight loss. Yeah. So if you're having unexplained weight loss and fatigue, so tiredness, fatigue and appetite change, they can cross over a little bit, but if you're having those symptoms, we do have to think about the bowel. Yeah.
And what else specifically with the bowel? We have things like a change in bowel habit, don't we?
Yeah, so a persistent change in the bowel habit, it's not just I've been on holiday, I come back and have a bit of loose stool.
Yeah, or a bit of constipation, which everyone gets a bit from time to time. But if it's not getting better, isn't it? If it's not going back to your normal, and because sometimes everyone has different, amount of time that they go for a poo. So if someone is changing what's normal for them, isn't it?
If you're a person that normally goes every day and then suddenly you're not managing to go until 3 or 4 days, and it's a struggle, or you've blood in your stool or your poo.
Yeah, so blood in your poo, that's a worrying one. And often it is just down to kind of hemorrhoids, isn't it? Like piles. Yeah. So people are rightly kind of worried about it. Most of the time we can kind of reassure them, often with an examination, can't we? But certainly don't ignore, I think, blood in your poo or when you're wiping your bottom. It just needs to be checked out, doesn't it?
Yeah, we need to know about it. Make sure it is just something simple like piles. And if not, then we can investigate.
Yeah. And also people can just get a lump, can't they, around the bottom or sometimes in their tummy. And that's something we need to check out.
Yeah, so abdominal tummy pain or a lump in your tummy that you didn't notice was there before.
Yeah.
Come and see us and we'll investigate that by doing an examination. And if you need anything further, we can talk to you about that too.
Yeah. And a lot of patients will have done the bowel screening test that they get in the post, which looks for any blood in the poo, doesn't it? But even if that's been normal, I still say to patients, I still want to check out that this isn't something like a bowel cancer, because that can actually give what we call kind of a false negative. So it still could be something, but it's a good screening test to do, but it's not perfect.
Definitely, like most screening tests, it can miss some cancers. So we have another test that we can do, something called a FIT test.
Yeah.
And that's slightly more sensitive. So even if your test was negative and you have some of these symptoms, come and see us and we can do another test.
Yeah, and that's another stool sample, isn't it?
Yeah.
And it just looks again for the blood, but it's a bit of a better test.
But we also do bloods when somebody comes about these symptoms, because you can have what we call iron deficient anemia.
Yeah.
So if your iron levels are low in your blood, we need to look at why, and that's a bit of a red flag.
Yeah, because sometimes that can be a sign that there's bleeding going on somewhere, can't it?
Yeah, in the gut.
Yeah. So we definitely need to get that checked out.
So we've got tummy pain, lumps in the tummy or around the back passage, bleeding from the back passage, change in your bowel habits.
Definitely.
And
the weight loss and the fatigue as well. So
they're the main ones. If you have any of these symptoms, we can start to investigate and look into it.
Yeah. The other thing I would say is don't be embarrassed. Patients are often, they wait a bit too long because they're embarrassed. I think especially younger people, because bowel cancer, a lot of the kind of risk factors are for older patients. But we do know younger people can get bowel cancer as well. So we do need to be really alert to that. And I would just encourage people to come forward and not be embarrassed, because I often say to patients, I'm not embarrassed if that helps. We do this a lot. We talk about poo all the time and we examine people's back passages. So don't stop coming to the GP because you're embarrassed. I think that's really important.
Yeah, and if you'd be more comfortable with a male GP or a female GP, that's not a problem. We can sort that out as well. It's one of the things we're very used to doing, and we don't need to be embarrassed about it. We're happy to make the situation as comfortable as they can.
Yeah. Okay, shall we move on to talk about breast cancer, which obviously mostly affects women on the whole. There is some men who can get breast cancer, can't they? But what red flags do we have for breast cancer?
So one of the most common ones is a lump, a new lump or a changing lump in your breast.
Yeah, or like thickened, like it feels a bit thicker in one area, even if it's not like a discrete lump.
Thickened breast tissue or even into the armpit.
Yeah, because when women are examining their breast, they should remember always do the armpit, actually, shouldn't they?
Yeah.
And we do when we're examining, don't we?
Yeah, so a self-exam once a month is recommended, and try to do it at the same time each month when you're in the shower. And if you're unsure of how to do this, you can ask your GP to show you.
Yeah. So then there's the thickened tissue or the lump, and that lump, as we say, might be up into the armpit. And what else?
So nipple changes.
Yeah.
So we've got discharge from the nipple. Bloody discharge is definitely a red flag. Itching, skin change and discoloration, like a rash that appears around the nipple. Anything that's out of the ordinary, and even inversion of the nipple.
Yeah, so if the nipple kind of sinks inwards.
Or a bit of puckering of the skin, that can also be a sign of breast cancer. So if there's any change around your nipple you're not sure about, come and see us.
And the puckering of the skin could also be around the breast, couldn't it?
Yeah.
Yeah, so sometimes, because if there is a breast cancer, it kind of can change the way that the skin looks, can't it?
Yeah, so the first bit of our examination is just looking at the two breasts together to see, is there anything obvious or asymmetrical?
That's right, yeah. And some people will have an increased risk of breast cancer for various reasons. Obviously, a common thing is that a family history of breast cancer?
Yeah, normally down the mother's side. So if your mom or aunties, sisters have had breast cancer, they may have had another test to look at the gene involved. And that's all important in us diagnosing and deciding whether this lump is something to investigate.
Yeah, but I guess even if anyone doesn't have a family history, we still want to investigate and rule it out, don't we? I would say that breast lumps are actually, there's a lot of what we call benign breast lumps, aren't there? So things that aren't cancer and that we don't worry about. So not to panic if you feel a breast lump, because it very well may not be anything to worry about. But of course, we want to get checked out. Sometimes we may say, if it's for example, a younger person who's got a breast lump, we might say, wait and see if your next period and see if it's gone by itself. Yeah. And if not, then come and we'll examine you. And then usually we can, if we are worried, we can get them into what we call the 2-week wait again, can't we, for the breast cancer clinic. And what do they do there?
So at the breast clinic, you'll be seen by a specialist. They'll take a history, examine your breasts, and most likely if there is a lump, they send you for an ultrasound or an x-ray, depending on your age. And from there, they'll decide whether they need to do anything about the lump. So if it looks suspicious, they might do a biopsy, or they might call you back to do that at a different date. But you will find out on the day if they're worried about this lump or not.
That's good, isn't it? Because there's not too much waiting around.
No, it's a really good service.
Yeah. And they're very happy. We're kind of always happy, aren't we, to see anyone who's worried about a breast lump. Sometimes people say, oh, it's probably nothing. I'm probably wasting your time. And I say, you're not wasting my time. Even if I can reassure them, then that's not a waste of time, is it? And I always say, even though I've reassured you now, if it changes and you're worried, I want you to come back.
Yeah, definitely. Don't take that worry all onto yourself. No. Come and see us. And the other thing that was common in breasts is breast pain.
Yeah, people worry a lot about breast pain, don't they? But actually that isn't a red flag for breast cancer, is it?
No, breast pain is very common and normally related to your menstrual cycle, and it's never really a sign of breast cancer.
Yeah, so that's actually quite a reassuring thing to know, isn't it?
Yeah.
And then finally, the other of the big 4 cancers is prostate cancer, isn't it?
Yeah.
Which obviously only affects men.
Because they have a prostate, but it does grow as they get older, so not all large prostates mean prostate cancer. So the things to look out for prostate cancer, we'll start with the waterworks and the urinary symptoms.
Yeah, so this is what most men come forward with first, isn't it?
So they've got problems with their flow, with the stream, it's not starting as quickly as they'd like, or they're having some dribbling afterwards, or they've got an urge to wee when normally they're fine.
Yeah, and going a lot more at night as well.
Yeah, so getting up at night more than once or twice, that's probably something you need to see us about.
Yep.
But then we've got common red flags that have overlapped some of the other cancers, like weight loss and fatigue.
Yeah, I think that's especially if it's spread, isn't it? So, because often actually prostate cancer doesn't have any symptoms for a while, does it? But if it has become more advanced, then I think especially you get that weight loss and that tiredness again, and sometimes kind of back pain or bone pain.
Yeah, so back pain or bone pain that doesn't go away with rest. And you haven't had an injury. So if it's waking you at night as well, that's something we need to worry about. Come and see us. We need to investigate your prostate.
Yeah. And also erectile dysfunction. So if you're struggling to get erections, then that could be because of the prostate. That needs examining and looking at, doesn't it, as well?
Yeah, and if your erections have changed, so if you can't keep an erection as long as you used to, or you found your sex life has changed and you're not sure why, that's something we can look into.
Yeah. And the other thing is some men do come forward and they're finding blood in the urine. So weeing and seeing blood. And again, that can be because of an infection, can't it? But it can also be a red flag for prostate cancer.
Yeah, and blood in the urine and also blood in sperm.
Yeah.
So if you've noticed that's changed, that's something we need to look into.
Yeah. Okay. So red flags for prostate cancer, just to go over then. So it's changes most of the time it's changes in the kind of the waterworks, as you said, isn't it? So that going more often, especially at night, hesitancy, so having to take a little bit of time, or a poor stream, bit of a weak stream or dribbling afterwards.
Yeah, hesitancy, urgency, getting an urge to go.
Yeah.
All those waterwork symptoms, definitely something we need to know about. And then we've got those other ones like the weight loss, fatigue, that are a bit more later in the disease, but also important to remember. And the bone pain and night pain.
Yep. Okay, I think it's also useful if we just touch on the screening that's available, certainly in the UK, that we have, that helps us kind of detect cancer early, doesn't it?
Yeah, so we've got a few programs. Breast cancer screening is one of them.
Yep.
And that's for women aged between 50 and 74. They get offered mammograms. So every 2 years they get called for a mammogram. It's really important to go for this examination. It reduces your chances of missing cancer and gets a diagnosis done early.
Yeah, that's certainly important. And we've not talked about cervical cancer because it wasn't in the top 4, but there is screening for cervical cancer, isn't there? So that's women who are aged 25 to 64, and depending on their age, they'll be invited for a smear every 3 to 5 years. And also just to point out that trans men who still have a cervix would also be included in that as well.
Yeah, it's really important not to miss your smear test because it's a very preventable cancer if we catch it early. And now the other program they have in place, the HPV vaccine, has reduced cervical cancer rates enormously.
Yeah.
And then we've got bowel cancer screening, and that involves a stool sample or a poo sample gets sent out to you in the post. It's for men and women from the ages of 60 to 74. And it's every 2 years you receive this in the post. You send off a poo sample and you get a result. Now, as we said before, if there's other symptoms, you still should see your GP, but it's a great way of trying to diagnose early bowel cancer.
Yeah. Yeah. And then a lot of people ask about prostate cancer, and there isn't currently a national screening for prostate cancer in the UK. But we do often do a blood test and examination for any men who've got symptoms of prostate cancer or who are worried about it. I've got a video actually about this explaining a lot more. So if anyone wants to find out, have a look at that. But I think it's worth pointing out, as you've just mentioned, really, that these screening tests aren't foolproof either, are they? So that's why it's really important to know these red flag symptoms, isn't it? Because the key thing I think that we want to get across is how important it is to be aware of these red flag symptoms and therefore to get seen as soon as you can. Isn't that right? Because we want it to be caught early, don't we?
Yeah, that's the purpose of them, and that's why we say they're flags. So it'll flag up to us what if there's something going on. And if we do diagnose it earlier, your outcome is going to be much better. So anything that we've mentioned before, if you're worried, come and see your GP and then let us worry and let us decide where to go next. And we do have the 2-week wait program on the NHS, which is brilliant. We can get you seen within 2 weeks if we have these concerns.
Thank you, Lisa. That's been so helpful and really nice to discuss that with you as a fellow GP as well. All right, I hope you found that really useful, and do have a look at my channel. I've got lots of other helpful videos. So do like and subscribe and share with anyone else who also may find it helpful.